All right, everybody, it is Friday. We want to welcome you to Coronavirus Inside the Arizona Numbers, where we take a much closer look at the data coming out of Arizona and help you better understand and apply it to your life. We're not here to make decisions for your life. We're just helping you be guided through these numbers. You know what's best for your family and your life. But these numbers, Garrett, all the more important starting today because as we learned yesterday in Governor Doug Ducey's news conference, a lot of school districts are going to set up their own metrics and their own data which to judge this against. So a lot of parents are interested in this information, and we want to help best guide you through it and show you where you can find this info online so that you can check it each day, even when we're not here with you on the weekends. So I want to introduce myself. I'm Katie Rammel from ABC 15. Alongside me here, Garrett Archer, virtually alongside me at his home. I'm at my home, safe at home. And let's get right into the numbers. We want to remind all of you that are joining us, leave us a question or comment and we'll help you find that info. If there's a metric that your school district is starting to talk about and you want to know where to find it, let us help you. We'll show you exactly where that is online and where you can watch it every single day. So Garrett, let's start where we always start, and that's with the summary page that's on the Arizona Department of Health's website, or many of you who are joining Garrett on his Twitter account. He posts that there every morning, and I repost it as well for you so you can get a closer look. Let's see. Let's dive right into the numbers. We finally, Garrett, had enough cases coming back. We had that dip in the number of, I should say, the number of test results coming in. That helps us get a better idea of the cases out there. It was back up to about 15,000 tests run through today.
Yes, we're starting to get some of the backlog from Sonora Quest is starting to fill in here. So let's just go through these numbers. Number of cases today, 156. Well, this is the number of total cases, 156,000. We've gone over 1 million tests, as we've discussed, and then 3,142 deaths is our total. The number of new cases reported today, 3,349. The number of new deaths, 79. And these numbers, again, these case numbers, 3,349. The majority of these are PCR cases, and they come off of PCRs of 14,000 tests. That is a positivity rate, or at least a ratio of about 24%, and which is about where in line as we have been. It's not an amazing number, but you must understand that we've talked about this. This 24% is more of a proxy, sort of a let's follow where this goes over the course of time, because it's not our true percent of positive. But it is useful to see where things are going as far as when tests are being processed.
Yeah, one thing, Garrett, Jamie Lynn's writing, I've still been waiting 13 days for my results, still processing. We think that that's unacceptable. I know that state leaders agree, and they're doing everything to try to get this processed quickly. What we heard from the governor, and that I can tell you about this, Jamie, is that they're going to have all these processed, they say, by July 31st. What is that, next Wednesday? I've lost track of the days here. Next Friday. They're planning to run them all through. And Jamie, as we saw over these last couple of days, and we've documented here with you, there have been about, 5,000 cases each day, Garrett, and now finally back up to 15.
Yes, so we've and we can see the majority of what was processed today. And this is what, if you remember, the governor talked about how the testing demand, the immediate testing demand has gone down, and we can sort of see that reflected into the numbers today. The Sonora Quest, on their dashboard, they reported about 54,000 pending tests. That's down from 61,000 that was reported 2 days ago. They didn't actually release a dashboard yesterday, but based on the number of tests that we got back, we know that they didn't process a lot yesterday. So they are getting through that backlog, but on top of that, we're not seeing these long lines at these testing sites right now. So they're able to get through the backlog right now. You know, as long as that's the way it is, we'll get through this backlog quickly.
And they said, Garrett, I think it was something around, 30,000 tests that they can push through when this new system gets set up at Sonora Quest. It was a pretty high number.
Yeah, they said it was like 4 tracks and they could do 30,000 a day or something like that. It was pretty crazy what they said they could do.
Yeah, so Joy was just commenting on that 61,000 in the backlog. That was yesterday, Joy. We're happy to report it's the backlog. What did you say, Garrett? 54,000 right now?
Yeah, just over 54,000 tests.
So it seems like they're processing the test of the day and then also getting another 10,000 sent through. So Joy, hopefully they'll get through these numbers pretty quickly. And we'll show you today, Joy, what things are affected by that backlog and what numbers are not as affected by that backlog. We'll get through all that together today. So hang with us, Joy, and we'll continue to talk about that as well. Let's see. Anything else on this page you wanted to highlight before we move on to some of the other items today, Garrett?
The only thing to highlight is based on, one of the things to sort of look at, because I talked about that ratio being, a number to track, but this is another one, which is the total cumulative PCR percent positive. We want to see this basically stay the same or start going down. Right now, today it stayed the same again, so 14.6% positive. That's a good thing. Obviously, we want to see that number stay where it is right now.
Yeah, exactly. When we break out Maricopa County out of these numbers of the deaths that were reported to us overnight, it was 79. But then in Maricopa County, 67 of those were right here in this area. And of the cases, how many cases did they log here in Maricopa County?
They did 2366 today in Maricopa County were reported to the AZDHS. That's off of almost 10,000 case PCR tests. And you can see the percent positive for Maricopa is slightly higher than the state's cumulative. It's at 16.1%.
Yeah, so if anyone's interested, if you're in a different county watching, you're able to hover over on that map and see the breakdown for your county as well. Marjorie's asking, why don't you say how many recovered? Marjorie, long story short, there's different degrees of recovery for different people. Different age groups recover differently, and so do different health conditions inside people. So the best number we have right now comes from a site called covidtracking.com that we kind of peek at each day, but it only gives us a slight framework. I think we're at about, I checked it this morning, 19,737 discharge numbers from the hospital. That's the best number that we can give you so far. But Garrett, you kind of did some calculations because we get asked this question every day, and we always want to address it and help people better understand the number, the possibility of the range of active cases that we have, because we hear 156,000 cases in Arizona, but by your calculations and the other numbers that you've been looking at in here, what sort of range can you give for what you believe to be the possibility of active cases in Arizona right now?
So yes, what I did was I took all of the cases and on the epi curve, which is the date of occurrence, and then I took them and basically said, okay, show me the cases that are, what's the number of cases that are over 14 days? What are the number of cases over 28 days? And what are the number of cases that are a hospital discharge? And the reason we have these three estimates is the first estimate, the majority of people that are younger, they will not recover, but they will become an inactive case within 14 days. And those that are a little older, it will take them about 28 days to become an inactive case. And what we have here is about 20. So if we were to take the cases over 14 days, about 20,600 active cases remain in Arizona. At over 28 days, about 75,000 active cases exist in Arizona. What that means essentially is that we're going to be in that, between that range. So the number of active cases in Arizona right now is between 20,000 and 75,000. It's impossible to know the exact number of those, but it's going to be within that range somewhere.
So when we say active cases, is there any more parameters that we can give people for a definition for that? Would that mean they could transmit the virus? Would that mean they're feeling symptoms? Or is that just the best number we can get to? Yeah,
it's essentially using the CDC guidelines on what is considered sort of a symptomatic case. So those that have a mild COVID condition usually are done with the virus within 14 days. Those that have a moderate to severe, the virus stays within in a time frame of 28 days. Now, of course, there are, obviously, we hear anecdotes and other stories of people that have been in the hospital for weeks on end, and that is absolutely accurate. That does happen. But as far as an aggregated sort of statistical estimate, the majority of cases, this is sort of the range we're going to be looking at. And I don't want to call these recovered because, as you said, there's a reason they haven't settled on a definition recovery, because it's not necessarily a recovery. It's just that there's about 21,000 to 75,000 people in Arizona right now that possibly could transmit the virus that have been confirmed positive. Obviously, when you look at modeling, that number is much, much higher. But this is just based on the numbers we have from the AZDHS.
All right, Marjorie's saying thank you, and a little smiley face there. Marjorie, we're happy to help. Recovery is a question we get every single day. It's a question we get into the newsroom as well, so we do not mind explaining that here and helping you find that information and adding Garrett's expertise to all of this. So we're glad that that helps you. So let's see, any other numbers on that page that we want to get to before we move on to some of the other things? I'm seeing Brant asking about RT Live, well, the R naught number. So if we're done on that page, we can move
let's
to that.
go over hospitalizations before we go to the R naught number. So,
Brant, hang on. I'm going to tell Brant to hang on because I saw this question come
we
up.
will definitely get to the R naughts. So just going through, this is the total census numbers. And you can see very little change between now and about 3 days ago, 4 days ago. We sort of stayed steady in the ICUs. And this is COVID agnostic. This is just number of beds. You can see we've seen a dip from last week in the emergency beds. Inpatient bed usage, we've also seen a dip. If you looked at previous years of hospital censuses, we should be seeing dips right now. You know, if COVID wasn't around, we should be seeing dips. So hopefully this means we're sort of kind of going back to normal in the hospitals. Now, going to the COVID-19 specific metrics, we're still seeing a downward trend on the inpatient, the acute care beds. This is a great sign. As you can see, we've had a consistent downward trend since July 17th. And that's great. We've gone from a high of 3,517 in inpatient beds, COVID positive, to 2,844. That's fantastic. Ventilator use also went down to 575. ICU down to 837, and you can see still a consistent trend downwards. Discharge number was about 434. You can see this is where we are at a hospital high, and we've gone down. We've stepped down a couple for this week. Emergency rooms, slightly higher, but as you can see, the general trend, which is what you really want to look at these, is going downward from this, which was July 7th, which was absolutely a high here in Arizona. And then intubations up again a little bit, but again, intubations is one of those you want to look at the trend, because as you can see, it's a very noisy data line.
Mickey's asking, could the downward trend on patient beds be due to lags in reporting? We're not seeing the same lags on our hospitalization numbers. We get those right from hospital data, right, Garrett?
Yeah, so if there is a lag or some sort of disagreement in this data, it's only going to be about 48 hours. It's going to be a very low lag time. Unlike some of the case and test information we're getting from the AZDHS, which are up to 16 days of a lag at this point, this is pretty close to real time. It's as close as we can get. And I'm just going to address this now so we don't have to talk about it again. This does not go to the CDC. It does not go to the HHS. It does eventually go there, but not before we see it. So we see it before anyone in the feds touch it. So it's not being quote unquote manipulated by the feds or anything at this point.
Yeah. Thank you, Mickey, for that question. It's important to always assess the lag times in some of these. Let's see. Anything else on this page, Garrett?
No, I think we can get over to the other stuff now.
Okay. The RT Live question, or the R naught question, was coming from Brant just a few minutes ago. Brant, sorry to keep you, or Trent maybe. Let's see. Let me scroll back. There we go, Brant. Okay. Brant, thank you for the question. Let's take you to that page. Obviously, as we've been telling you, this is affected by case numbers, and we just got a lot of those tests processed so that we saw a lot more data coming from case numbers today, and that has changed our curve. We are once again above the number 1, which, Garrett, that's why it's so important to look at that whole colored in range, not just the exact number that it gives us.
Yes, and I'll go back to the other page to show this. Like you said, the R naught estimate is very it's going to be subjected to the backlog pretty tremendously. So because of that, we do really want to focus on the error bars on this particular page. So I'm going to darken my screen really quick so it's a little easier to see. And here we are, AZ, and let's see if I can bring it in a little closer. And you can see Arizona has a range of 0.79. Oh, I moved it. Sorry, 79 to 1.22. So that is basically our R naught range. The experts say we are very, very confident, up to 95%, that Arizona is within 0.79 to 1.22. As far as the confidence of it being 1.01 or anywhere around that, that's a little different. You know, there's some probability, you know, statistics you can run on that, but that's the range they're looking at right now. I mean, I've seen also some of the RT calculations have also gone down. I've seen one on the model that I like to follow. It's actually gone down to 0.9 today. So there's some divergence in methodologies occurring right now on these estimates.
Yeah, okay. We want to get to some of the other questions coming in. In fact, Lisa just writes, according to one statistician, Maricopa County currently has the second highest number of coronavirus cases in the country. And Lisa, you're absolutely right. That's something that we talked about yesterday. I was saying yesterday that we have the fourth most populous county, but we have moved to second place, if you will, for the number of cases. So we are in second place. We hung out at third for a while. Cook County and LA County have been above us. And then yesterday we passed by Cook County, Illinois to be in that second place spot. So Lisa, you're absolutely right. Oh, Garrett, you have a graph for that too.
So this is the URL for this is extremely long and there's no way we can share it. So what I can tell you is if you're on Twitter, you can go to @datadrivenmd. That's @datadrivenmd. And he is the doctor that is putting these statistics together. And it's on this is a dashboard. So you can see there's several different options you can look at for, you know, the different ways to look at this data. I have focused on the county level detailed summaries. And you can see it starts out in the case per capita. And a lot of these are very small cases with the exception, or counties with the exception of Miami-Dade. That obviously means that as far as case per capita, Miami-Dade does have some issues right now as they are within the sort of top numbers for this. But let's just go to the total cases. We're going to move this. As you can see, this is done by population. So yes, people will say, well, this isn't per capita. You are correct. The population is going to absolutely determine the ranking when you're talking about these sizable counties. LA County has more than 10 million people. You know, they are, in more cases than not, Los Angeles County will always be at the top of this list. But here we are, Maricopa County, have a slightly lower population than Cook County and a slightly higher population than Harris County, or excuse me, is a slightly lower population than Harris County. And we are at number 2 right now. So what that's saying is, you know, and here's Miami-Dade. We just talked about that with their per capita number being so high. But what we're saying is as a large county, one of the largest in the country, we do have a decent sized pandemic here in Maricopa County, but it is certainly not as bad as some of the other places. You know, like I said, Miami-Dade or some of the other small counties, which can, you know, 40 people getting the virus in a small county can change their per capita dramatically.
Yeah, I can kind of throw the curve off. As we always mention, you know, the population's not even across zip codes. It's not even across counties. So while all this is worth looking at, it shouldn't be the only thing that you're measuring this by. So thank you for those comments. Let's see, we had one more come in just a minute ago. Of course, I moved my paper. Oh, Patricia. Patricia was asking about the number of kids who are sick. I know that's on a different page, Garrett. So we'll let... There's the question. I ask this every day. What are the numbers for kids? We are happy to show you the numbers every day because I know that this is so important, especially now. For those of you who are watching not from Arizona, yesterday the governor spoke and the parameters he gave for opening schools are to let each school district come up with their own metrics. So once we know the metrics for your school district, your specific school district, we can help you find that information online. So everybody's going to be looking for a different number very, very soon. That's okay. We're happy to help you find that, happy to help you track that, happy to help you log those on your banner at the top of your screen here so that you're able to search them every morning so you can kind of know how close your kids are to being allowed to head back to in-person learning. We, Garrett and I both have school-age kids, so we understand. Let's see. Are you going to pull up the county number?
Yeah, I'll pull up. Sorry, I'm going to pull up there's a page on that that Google Data Studio that I was just at. It does have some kid level data, but I don't have time to look at it. I'm trying to do it on the fly, and I need to really look through it before I can.
Those are numbers that we can even peek at closer for folks next week too. Yeah. But the baseline number, I know we were in the 14 to 19,000 range for kids who have tested positive for COVID?
Yeah, well, I'm going to show you a couple options here on where you can find that data. So we'll start with the AZDHS just quickly. We'll go to demographics right here. This is where you can see the number of cases of less than 20 years old. That is the best breakdown they have for that age group. And you can see 17,969 cases in that age group. And you can also see this in hospitalizations. Although this is a lagging graph, you can still see about 122 people under the age of 20 have been hospitalized. And you can also see this in deaths. And you can see that 11 people under the age of 20 have died from the disease. And so here we're going to take this also, I'm going to reshare a screen and go to the Maricopa County page. Oh, sorry, I went to the wrong one. My apologies.
That's okay. Hopefully oh, go ahead.
Nope, that's fine. And here on, now I'm at Maricopa County now, and I can show you this. Theirs is a little better because they give us a little bit more information. They also bring the age to 0 to 19. You can see the hospitalizations for them, 73, 11 in the ICU, and 5 deaths in Maricopa County from that. And then we do have, 1 second, where did I find it? There it is. Oh, I was just there. See, I'm losing my mind today. So
it's Friday, we understand.
Yes, and here you can see them against each other here. So you can see, and this is, like, sort of look at this. This is going to equate to 100% going down. So you can see 11% of all COVID cases are from that age group, 2% hospitalizations, 1% ICU, and under 1% for those who have died in that age group.
Sorry, my phone ringing right here. Garrett, thank you for those numbers. I imagine that we're going to be started to have people asking that every single day because they're so concerned about their kids. So thank you for the question. We're happy to help you find it. And those are the best places to sort of track it there. But 17,969 kids is what Garrett had said. So hopefully that helps. I saw some thank yous pop up in there. Debbie writes, thank you for all your help and helping us to understand that is exactly why we're here. We're not here to decide if your kids should go back to school or if you're ready to go to the gym or any of those things. We're here to show you where these numbers are, where these metrics are, so that you can track them for your family and make the best decisions to keep everybody safe. All right, Gretchen writes, after my son tested positive, we weren't given any information on what to do or info in contact tracing. He's now waiting for his second test results before he's allowed to go back to work. We're still waiting for his test results from the CVS 2 weeks ago. You know, we're hearing from people that went and got tested at CVS often on here who are seeing a delay in their results. So, boy, I know that's got to be just hard to sit and wait for those numbers to come in. I had a friend who, in the middle of this, got sick, and she had to have 2 negative tests before she was allowed to go back into her healthcare job, helping other COVID patients. And, you know, she was just locked in her room waiting for a negative test result and a second negative test result so she could go back to work. So hopefully they're going to get caught up on this backlog of cases pretty soon and these numbers pretty soon. All right. What about the people teaching the kids? Kimberly writes, many are in high-risk categories. Absolutely. So when we stress these numbers about kids, we're never forgetting the teachers out there. So many teachers, so many educators, and staff all going back to work. Sadly, we have had to tell the stories of just beloved educators and school coaches, a swim team coach, Carrie Crosswhite, who we lost, and some teachers who went back to summer school and got sick and did not survive. So we are always keeping our teachers and our educators in our thoughts as well. Yes, several are in high risk categories. The saddest thing is I've heard from some of these teachers who have worked for these places for 3 decades. They've dedicated their life and their career to these schools, and they don't even feel safe going back right now. So hopefully these school districts and these places can make sure that they're safe as well. All right, lots of questions coming in. Garrett, have you seen any that you want to quickly answer? I know they're coming by so fast I can barely read them as we're updating the ones that we do have a second to tell you.
Since we were talking about schools, I'll go over the sort of the modeling that we've seen, and what modeling is useful for is at this point in the disease progression is to sort of get a better idea of what the actual sort of community what the active cases looks like, or at least the total cases in the community, because there's just it's hard to say. We've got X amount confirmed cases, but obviously there's going to be a lot of other cases, especially those that were mildly symptomatic, that also had the virus. So I'm going.
And you're on COVID-19 projections.
Yes, I'm on COVID19projections.com. Yes.
And this is open to the public, so we'll put the address there. Producer Carrie added it to the bottom of the screen. So for those of you who want to bookmark that, that's where you can find it.
And you can see, based on where these projections say we are, you can see as far as it believes that we are sort of at the peak of the daily death curve right now. So we should, in the next week or two, based on this model, and it has been very accurate, at least its trend lines, that we should start to see a decrease in the number of daily deaths. But of course, we're still going to be seeing an increase in the total number of cumulative deaths. And it does believe that by November 1st, we'll have about 6,800 total deaths from COVID-19 by November 1st in the state. And you can see this is where I was talking about the R naught for this particular model has us down at 0.9 right now. This is where it sort of has now diverged from the RT Live. RT Live was 1.01. This one is saying 0.9. So this is why we're saying check the error bars at RT Live because that's a better estimate of what's going on. So, and you can see on both of these currently infected and all of these other numbers, this one thinks that active, this is their active number, similar to the one that I gave. This one says the upper range 30,000, lower range 10,000. It says it's definitely on the decrease. And then the total infected, this is 315,000. It thinks about 315,000 people in Arizona. Anywhere from 500,000 to 170,000 people in Arizona are walking around with the virus. That would include those that are tested positive, but also those that haven't tested positive yet or have been waiting or whatever. And then the total infection so far, 1.3 million is their best guess. When we get closer to school, at least the online learning and when school was supposed to sort of start up, we're looking around 1.7, anywhere from 2.6 million to about 1 million people.
Thank you, Garrett, for that. Mary Ann's asking, Katie, can you do a live web just about schools? Parents and teachers can ask questions and concerns. Yes. We've actually done that, and I will remind you guys on here of the next one that's coming up. I know that we'll have more. Danielle Lerner hosted our last one. It was, Mary Ann, it was a format just like this, and she had exactly that. People that you can ask questions from who are in charge of school districts here. So I will be sure to let you know as soon as I hear of the next one. You can also follow Danielle Lerner on Twitter or on Facebook. There's her Twitter address. Marianne, she is our dedicated education reporter on this. She's working round the clock and updating all of that. And I know if you follow her, you'll get the information on the next one, but I'll also bring it up here as soon as I hear that we plan it. It's usually around noon-ish that we do those sort of town halls right on here, this very same format, this very same place. So we'll absolutely tell you about the next one. I know it's a very hot topic right now, so I don't doubt that we'll do that very soon. And then Marianne, also producer Carrie's added the web address there for the map that shows all of the school plans here in Arizona. It's www.abc15.com/schools. It's got an interactive map. You can hover over your district and find out exactly what their plans are or what their proposed plans are right now. Boy, Danielle has a lot of work cut out for her with the information that came out yesterday, because now it's going to be every district kind of on their own instead of one statewide order. So we will for sure keep that updated and keep Danielle in our thoughts, because she's going to be continue to be very, very busy. Go ahead, Garrett.
So I saw Al put out a question. How do the 600,000 or 60,000 tests not processed affect the numbers presented? So just wanted to address that, because he is right. There is absolutely an impact on these numbers with those 60,000. It is now 54,000, but still close enough. And just showing, I'm going to show the graph of what he's talking about. So this is my epi curve graph. The light blue are added today, and the dark blue was there yesterday. And you can see this very strange pattern happening where there's a lot of tests being, or cases being added to the epi curve from the last 72 to the last 4 or 5 days. And then it takes another 12, 13 days for another basically batch of tests to be added. So the concern here, of course, is that the lag in these cases is anywhere from 1 to 16 days. And this is what we were talking about. We've seen people comment on this saying, oh, I've waited 11, 12 days to get my test processed. And this is exactly that. There are some cases that are coming in today that were collected 16 days ago. So how does that impact the numbers? Obviously, it will, if those numbers that are being added, if there's a significantly higher percentage of positives, especially on that back end, it will eventually increase sort of our peaks. This last week, this first week in July will no longer be a peak. We will now have a peak of this week. And so this is why we tell you to be cautious with the RT number, because we have this backlog and we don't really know what the percent of positives of these backlogs are, then it's difficult to know where we really stand with the R naught and with sort of what the true percent positive is, because it's taking 16 days. So really, for our purposes, for evaluation and for looking, the answer is we don't really get to know what's going on with the curve for another 2 weeks. So, and there's also obviously medical implications and other things. If someone is actually positive, and it takes 16 days for them to determine they're positive, are they still transmitting the virus at that point? Are they not transmitting the virus? I mean, that's things that can't be quantified, but it's still a concern. Here you can see this is another representation. 1,616 cases added 3 weeks ago for the July 5th week, and 843 the week last week, and then 782 this week. This graph should be flipped. These 1,616 should be sort of in these two, and then this number should be much lower. As you can see, before that there's nearly no cases being added before the week of July. So this is a representation of the backlog. We need to see this flip, and hopefully in the next 4 or 5 days, it will flip.
So Garrett, when you say you think that it'll be caught up, the epi curve could be caught up in 2 weeks, do you not think that it could maybe be caught up in a week once those other tests are processed? Or are you factoring in also that you have a 7-day lag generally in there?
I will always put a 7-day lag in there, no matter what. So no matter what, I will always have a 7-day lag, because you have to give the epidemiologists time to process the data. They've got a meticulous job. They're being swamped with all this information. They want to make sure they get it right. So we simply just have to give them time. We can't look at what's happening that day and say, oh, look, trends are down or things are up. What's going on? Like, you got to give them 7 days to settle. And so that's why it's just in 2 weeks, we'll sort of know what's going on.
Obviously, it would just be our own state projections. But if you're seeing a certain positivity rate and you have 60,000, when we did have 60,000 backlog cases, are you ever doing the math in your own head like, okay, if I'm thinking that this range could be within here to here, how would we look?
Yeah, so that's a great point. So I'm looking at that right now just based on what you asked for.
So because I have to say when I'm thinking of those 60,000 cases late at night when I'm trying to fall asleep, of course, I'm thinking, okay, 60,000, like, let's just say if it was 20% were positive, what number, like figuring that in, what number does that give me? And then projecting that there just to try to find out in my own brain if we're still in this curve or if this is part of the plateau, just to say what could the range actually be if we went as high as 25% or if we went as low as 15% positive.
And it does, I'm looking at a spreadsheet right now. So if I'm
you don't mind.
looking at the camera.
I'm basically on here reading the comments as they go by so that we can get them answered.
Yeah.
So it's okay.
It does appear that from that time, it looks like when you average out the dates, it's going to be about 20%. So based on that, the remaining PCR positives, we're probably looking at around 11,000 additional cases added to the curve from there. Now, of course, the question is, are they still transmitting at that point, or what happened at that point? We just don't know. That's where the lag is the most concerning. We can't contact trace something that takes 16 days to process.
Yep, exactly. It was interesting yesterday in the governor's news conference when they called the lag in reporting frustrating, because that is the exact word that we had used. Someone on a polite viewer on here called it confusing, and I said yes, that is the polite word. I would even call it frustrating because it is so so delayed. So it's better news today that we're finally getting that caught up. JD writes, do you have any information on people who are waiting in lines to get COVID tests? They leave because they don't want to wait in line, and then they get contacted saying they had a positive test when there were 0 tests completed. I know of a few people this happened to personally. JD, thank you for the question. We get this a lot. There are no cases of this. Now, it doesn't mean that this couldn't happen. It doesn't mean that it's not happening. It just means that all we're getting from this is an internet rumor at this point. Everybody's saying, like kind of what you're saying, JD, my 3 friends, I heard that this happened to them. And I personally have tried to trace down a number of people to figure out who actually did this happen to, who has that letter that said that this and that and the other thing. We are not finding a case of it. So I thought maybe it's happening other places and just not at all in Arizona, thankfully. Then I started seeing other reporters who I'm friends with online ask for the same thing. I saw a reporter friend in LA saying, if somebody is a first person case of this, please contact me, because we just kept seeing this internet rumor, and that was all it turned out to be. Then our station, our sister station in Florida, took this a step further because their governor there had repeated this internet rumor. And so they went to look into it, and they talked to all the testing sites there in their particular city in Florida. And the way that they were structured in Florida, they don't even take your name or your information like that. So there was no way that that could have even happened there. It's on our Facebook page on ABC 15, and I can even reshare it on my Facebook page a little later today. But they looked into it, and they just could find no cases of where this actually happened. They went back to the governor on it, and then the governor said, oh yeah, if this happened to you directly, please contact the governor's office. They didn't have any firsthand cases either. So that's the most we can tell you about that. If you want to email us, if it actually happened to you, not your friend, not your mom's friend, not your uncle, if it happened to you, send it in to share@abc15.com, and we'd be happy to look into it for you. We'd be happy to try to trace down if this is happening here in Arizona. We just do not have any cases of this. Let's see.
I wanted to address one thing because I saw it come by. A friend of mine, it's an acquaintance of mine, Sandy Bartlett, having a conversation with a guy named Hold2 about the what we just addressed with the percent positives. So I have actually I have had a conversation with Hold2 on these particular numbers, and what I'm going to say is, as far as the estimates we just made, that is based off the epi curve. We were, and I've got my chart shared to show that on that time, July 5th, we were showing and posting a positive rate of 19%. So this is why we have that estimate. That's the best we have, is around 19 to 20%. We have had tests at 19%. It has happened. It's right there. So I just want to make sure people know that it's there.
So what was that chart saying, or what was? Give us the backstory for those of us who are not.
Oh well, no. This is going back to and I don't disagree with this element, but with that 24% positive we were talking about. So today, if you just took the simple PCR, if you took the case numbers and the PCR, it comes out to 24%. Well, that number is starting to diverge and go away from what the actual percent positive is, because there's more, the prevalence of serology is going up. Mm-hmm. And so because of that, it's starting to create larger numbers of cases that aren't sending negatives or PCR tests into the system. So we're starting to get an inflated daily percent positive. So this used to not be a concern. Now it is becoming more of a concern. So this is why I started to split out based on conversations I've had with people like Hold2 on how to actually do an accurate reflection on that percent positive. For example, today, the true percent positive, or at least the true percent positive estimate for the daily report, is likely closer to 14.6%. That's based off of what we have, and that's taking out all the antibody tests, all of the tests that we can that we didn't give negatives for. Simply just the best way we can to say this is what we think it truly is. But again, that's an estimate. But it has been following the epi curve a lot better than that 24%, because she is completely right about that. We have not had a 24% day in Arizona in a long time.
So just to remind folks, two different types of testing that we're talking about here: the PCR test, which is like the nasal swab type diagnostic test, and then the antibody test that's checking to see if you ever had antibody, you were fighting this in the past. So thank you for clarifying that. Andy said
AZDHS combines this data in the dashboard. I know it's frustrating to people, but there is a reason why they're doing it, and it's for their epidemiologists. You have to remember that while this data is very important for us to look at, they've got a very important job to do as well. And so as much as it's frustrating to me that these numbers are reported, and I wish that they would split out the cases, they haven't. But you know, I'm giving them some leeway here. It's a data number. It does cause some noise in the data, but once you kind of look at the trends and the 7-day averages, it will sort of even out. So it's not like it's not the worst thing that could happen. There's many other places, many other areas of the country that have had worse reporting issues than we have.
Yeah. Thank you for clearing that up. I saw a lot of thank yous come through. So we appreciate all of you saying that. And the comment that producer Carrie posted up from Kathy, you're so welcome. We're happy to help you. She wrote, you guys are doing a great job of presenting and explaining the information. We're so happy to help you and to share a part of your day, for you to share a part of your day with us so that we can explain this and help people find the very latest information. Garrett, we just have a few minutes left already. The day just races by, especially on a Friday. There's so many things to talk about, and it's not ending anytime soon. I thought the other day, what will be the metric for Garrett and I to stop talking about this every day? Will there be a metric that we get to where we can graduate back to our regular lives at ABC 15 with the numbers that we're presenting each day? But I joke, but we're happy to do that. We're happy to help you with that.
Let's just say I can't wait to see a % positive of about 5%.
Same. And dang, we got so close in May. That was a number that I was watching very closely, and boy, just wish we actually got there and were able to stay there. Kathy's asking, what benchmarks do the two of you think are most important for reopening schools? It's going to be interesting to see, Kathy. We don't get to decide at all. Obviously, it's a bunch of healthcare professionals and educators coming together on that. If I had to guess, it'll probably be tied to that % positive. Don't you think, Garrett? That would be one of the.
Yeah, I mean that's the best way of doing it. If you do want to do it by case numbers, you have to sort of use a 7-day rolling average because of weekend reporting and other things. But you do need to, and that's one of the tricky things about metrics with this. You either use the epi curve and wait 2 weeks before you can make a decision, or you make a decision based on the daily % positives and the daily numbers, and you average it out and you do what you can to smooth out that data. Because the true data, it really does take 14 days to see what's going on with the true data, even in the best of times. This is not even talking about test lags or anything. You need about 7 to 14 days to figure out what's going on and say, oh, look, because you need 7 days for the data to fill in. And then you need to start saying, okay, now we're tracking the step down. You know, we're going from 14% to 13% to 12%. You can't even start the counter until those 7 days are up. So that's 21 days of waiting for a 14-day counter.
Well, and then, Kathy, I'm sure you're thinking about this too. Then once we hit that trigger, then how long until we would be sent back to school? You can't just be like, oh, we hit it on Tuesday, see y'all there on Wednesday. As parents, we'd be like, there is no way we can get this all going again and our whole lives uprooted and changed to go back to our new normal. So it'll be interesting to see what the benchmarks are, and then how many days past that will be the all signs go to head back to school. All right. Any other things we want to get to really quick in these last few minutes? Let's see. Look through some of the comments. We appreciate all of you joining us on here. All of these comments we appreciate so that we can help guide you through these numbers. As we always say, we're not here to make decisions for your family. We just want to help you be able to find all of these numbers so that you can track them, so that you can make the best and healthiest choices for you and your family, and especially now your kids, now that this is so affected by our school district. Stephanie writes, thank you. I've been super confused by the % positive going up daily for the last couple of days. Yeah, it's something we'll continue to help everybody through on here as this sort of levels out as we get this backlog of tests filled in. So, keep talking about it. Need to keep us informed. Those who don't hear about it, don't tune in. Absolutely. Thank you. Ray, that's exactly why we're doing this. There was some new data. I don't know if you saw this, Garrett, about like non-believers in COVID and all of those things that were coming out, and how difficult it was for people to grasp some of this. And I think that often comes down to if you've had somebody in your life affected by this, if you've seen somebody sick with this, or how long it took, a friend or family member to get better, or God forbid if you lost someone to this, because we always pause on here to remember more than 3,000 families in Arizona have lost someone. 80 families in Arizona are just going through this, the loss of a loved one overnight tonight. Those numbers just reported in, so they likely just lost them in the last couple of days. Across the nation, 145,000 people have died from this. So we're thinking of all those families who have lost someone and are mourning them and remembering them right now. All right, any other?
Yeah, I will go over just some good news. Again, I like to end. It's Friday, so let's do some good news. I'm going to the 91DVOC. This is the 91DVOC.com, 91-DVOC.com, COVID-19 spelled backwards. Fourth graph down in the visualization section, new confirmed COVID-19 cases per day, normalized by population, so it's per capita. And this is a 1 week average, and you can see that Arizona, at one point in about 17 days ago, we certainly had the highest, at the time, highest number of cases, even including New York, being reported in a day per capita. Florida beat us to it, but here we are today. We're not even in, what are we in the 1, 2, 3, 4, we're not even in the top 5 anymore. So we're starting to see, you know, these sort of going back, this pandemic is starting to at least recede in the number of cases. Now, as soon as this test backlog gets done, I don't know if this is going to continue. That's what I'm talking about as far as these statistics. As soon as we get this test backlog, we can look at these confidently and say, oh, this is where we actually are. So hopefully we're looking at this, seeing case numbers go down, but still kind of crossing our fingers that, you know, once the test backlog is processed, we're not going to see a big spike.
Yeah, so we'll have a lot to talk about next week as we watch those numbers of tests that are still out there, as we get those results in and we can better look at that. So that is a positive place to end. 17 days ago, we were so high on that chart. Around that time is when we implemented masks in Maricopa County. It's when bars and gyms kind of shut down. And so what you're doing is working. So keep it up, Arizona. Stay strong, stay safe. And as we always tell you, you can find the very latest coronavirus information on our website right now at abc15.com. Some people were asking how they scroll back in this. This whole video will be posted on here so that you can sort of scrub through and watch this entire video. Also, we're happy to say that because so many of you have found this information valuable, they're also sharing it now on your streaming devices, I believe at 7 p.m. and 11 p.m. So you can catch it there. And as always, I'll repost it on my Facebook page. You can find that there at facebook.com/news from Katie. I'm also on Twitter at Katie Rammel, and Garrett is on Twitter at Garrett_Archer. So several places that you can find us and catch up with us. We will not be here with you on the weekends, although Garrett always is gracious enough to post a summary around 8:30 to 9 o'clock in the morning on both Saturday and Sunday, so that even when he takes a day off, he's still working. I'll be sure to retweet those as well so that you're caught up on the numbers throughout the weekend. Remember, sometimes Saturday numbers are still high. We tend to see a dip on Sunday and Monday. And we will be right back here again on Monday to walk you through all of the numbers that come from Arizona. And remember, the very latest on ABC 15 News tonight at 4, 5, 6, and 10.